Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Sajid Majid, consultant child specialist. Today I'll discuss an frequent exam case, examination of rash. Your command will be examine the rash and relevant or do the general physical examination. First of all, introduce yourself, then take informed consent. Make position of the child. Head should be straight, arm should be aside, and leg should be straight, and whole body should be in one plane. Explain the procedure. Exposure should be adequate. A patient should be in panties. Then do inspection. First do inspection from foot end and then from the side end. Count respiratory rate. If you observe rash and child is healthy, don't think of irrelevant diagnosis of leukemia or aplastic anemia. Your differential should be ITP, idiopathic thrombocytic purpura, henoch purpura, and von Willebrand factor deficiency. Now, first look and then feel. Look for petechiae which mostly present in case of ITP or bruises which can be present in case of factor 8 deficiency, von Willebrand factor deficiency and ITP. Now check for distribution. Either it is present on the extensor surfaces. Extensor surface rashes are mostly allergic or flexure surfaces which are atopic or eczematous. Now look for border, either they are distinct or not. Then look for the shape of the rash, either it is macular, papular, vesicular, confluent or scattered. Then feel the rash, either it is palpable, tender, blanchable, which is mostly present in viral or allergic rash, or non-blanchable, which is present in the ITP, HSP and leukemic rash. Then take size of the rash. Then do the general physical examination. First do height and then do the weight of the patient. Then look for hand for pallor, nail for clubbing, BCG scar, head for any swelling. Then check for higher mental function by asking name and kalma. Then check for eyes for any intracranial bleed. Also look for mouth for to see the any petechia over hard palate, gums for von Willebrand factor, chest, and then examine the abdomen for any tenderness in case of henoch purpura. Check for hepatosplenomegaly, check buttocks and then legs. Then later on do the joint examination for tone, power, reflexes. In case of HSP they can be affected. Then do the gait examination, then cover the patient and say thanks to the patient. Now present the case in comprehensive manner, like a 7-year-old child, conscious, alert, quite comfortable during my examination, having pulse of 100 per minute and respiratory rate of 20 per minute, afebrile to touch. Patient is having height of 115 cm, weight of 22 kg, which is quite appropriate. But I want to plot on the centile charts. Patient is having obvious petechiae and bruises all over body, non-blanchable, particularly over abdomen and lower extremities. Largest bruise is of over left leg 2 into 1.5 centimeter. Though patient is pale but afebrile to touch, rest of my examination is normal in the form of no joint swelling, hepatosplenomegaly, lymphadenopathy, or any bleeding from any oral mucosa or any bony pain. On the basis of my examination, my differentials are idiopathic thrombocytopenic purpura, henoch purpura, and von Willebrand factor deficiency. Sir, I will do some specific or some sportive labs. First of all, I will do blood complete picture with peripheral film and retics. Then I will do antiplatelet antibody for ITP and bleeding time. I will also go for von Willebrand factor quantitative, von Willebrand factor antigen, Willebrand factor structure, and factor 8 level. I will also go for the LDH and uric acid for rule out leukemia. If there is any unexplained anemia, then I will go for the bone marrow examination.